This is actually a huge cohort of patients, around 174 patients of core binding factor acute myeloid leukemia, frontline, treated at MD Anderson. I worked on this with Professor Borthaker. So we looked at essentially the dynamics of the PCR response, the presence of kinase mutations, and the impact of the therapy arm on these patients. So previously, Dr. Bordeaux, who was a fellow here, he had worked with Dr. Borthaker, and they had established the optimal PCR cutoffs for these patients, which we define as post-cycle 1 or induction as less than 0.1% of the CBF-AML specific PCR transcripts. And post-consolidation, it should be less than 0.01. So that's known as the optimal PCR response, which has been acronymed as OPR in the abstract and the posters. We looked at the different kinase mutations, and we looked at which therapy is better, FLAG-IDA or FLAG-GEO. Now, we could do that because in the United States, for a brief period of time, Gemtuzumab was taken off the market. So at those times, our patients received FLAG-IDA, but thereafter, our patients routinely received Gemtuzumab. We found that patients who received the FLAG-GEO, they had better optimal PCR responses, both at the end of cycle 1 as well as at end of therapy, compared to FLAG-IDA. We did not find a significant impact of kinase mutations on both PCR responses or long-term outcomes. And that seems to be a persistent effect that we have seen here when patients are treated with FLAG-based regimens, that the impact of kinase mutations wanes away. Now, though more patients with FLAG-GEO have better optimal PCR responses compared to FLAG-IDA, we looked at different PCR combinations, early PCR attainment versus late PCR attainment, etc., and the impact of the regimens. And we found that all PCR combinations, FLAG-GEO does better than FLAG-IDA in relapse-free survival as well as overall survival. So we did both univariate and multivariate analysis, and we did a Cox proportional hazard model, and we found that FLAG-GEO does better. The impact of kinase mutation does not seem to be very important with FLAG-based regimens, and PCR responses are also more optimal with FLAG-GEO-based regimens.